At this moment of great concern regarding the pandemic of COVID-19, there are many questions that are being sent to neurologists who are following patients with Parkinson's disease. Those questions refer to the recommendation that should be adopted by Parkinson patients and their caregivers and family members, and also to know if the disease itself is an increased risk for more serious complications of the viral infection. The best scientific data we have till now do not suggest that Parkinson per se is an increased risk for more serious complications of this infection. On the other hand, we know well that age is a factor, meaning that people that are older than 60 years old have an increased risk of complications, including, for instance, the need to be admitted in an hospital. So, the recommendations for Parkinson community is that they should follow the general recommendations for the general population, knowing that those who are elderly should be even more careful regarding the implementations of those preventive measures. The other question that is being raised in the media refers to the use of specific medications and knowing if there are medications that have an increased risk of aggravate the complications of these infections. I would like to be extremely clear in sharing the fact that there is no scientific data at all associating the use of anti-Parkinsonian medications and an increased risk of complications with this COVID-19 infection. On the other hand, there have been other suggestions associating medicines used for the treatment of other disease, and even for those medicines, there is no scientific data suggesting that there should be a change in the regular intake of those medicines. So, in conclusion, my recommendations are that the Parkinson community should adopt exactly the same measures that are being suggested for the general population. On the other hand, there is no reason for a need to adjust medication based on the news that associated the intake of specific medicines with more severe complications of this infection.